There is a recommended intake. It's 6 teaspoons in a
6
day.
teaspoons a day.
A day, yes.
Okay.
That's the limit for 2 to 18 years.
Okay.
Yeah, that's it. So it's 25 grams.
But I wouldn't know anybody who has followed this.
Yeah, I'm sure everybody
don't follow. Welcome to the Food Pharmacy podcast. Today with us, we have our very own, the pediatrician mama, Dr. Ashka. She's a gold medalist and a lactation consultant. She has her own clinic, Nurture Pediatric, which is located in Shivalik Avenue, Bodakdev. Welcome to Food Pharmacy. We are so happy to have you here.
Thank you, Rajashree. It's been an honor to be here, to be a part of this podcast and sharing my expertise over here. As a pediatrician, I've seen that kids' nutrition plays a very important role in their overall health and well-being, and I would really like to share some practical tips and tricks so that parents can make informed choices about their kids' health and nutrition.
So, Dr. Ashka, you have experience of 10 years being a doctor, and also you're a new mother.
Yes.
What would you suggest our viewers to begin with, that what is the right kind of food for a kid?
So I think for growing kids, what is important is the protein intake is really important.
Yes.
Good enough amount of calcium, vitamins, minerals. So I think a lot of lot of focus should be there on having good fruits, vegetables, clean.
Yes.
I would say clean. And I would say organic nowadays. Have them in your diet. Make sure that you are having a variety of foods.
Yes.
That is also equally important besides building your proteins, your carbs, your fats. Even coming to fats, healthy fats are very important.
Yes. Omega-3s.
Yes.
And the balance between omega-3 and omega-6.
Yes. And one thing which is really very different from adults' diet is that the kids' diet, it should have 30 to 35% of fat intake.
Yes, good fats.
Yeah, good fats. Compared to adults where it should be 15 to 20%.
Yeah. Because they are in a developing stage and their brain needs more fat comparatively.
Absolutely.
Yes.
So it's very necessary that you are incorporating that in your diet and making sure that you are using, as you said, omega-3, omega-6, DHAs.
Yes.
Make a part of your diet.
So in spite of knowing all of this, we know that we have to eat healthy. We have to make sure that our kids are eating healthy.
Yes.
But at some point, that is not followed.
Yeah.
Because kids are a little fussy sometimes. There are this thing called, they have a choice.
Yeah.
Since a very young age, if we start giving them right kind of food, then it is easier when they are probably 4 or 5 and then 6, when they start being a picky eater or a fussy eater.
Yeah.
So what are the measures, how to deal with a kid who has certain choices?
So I think what we call these kids is, I don't want to label them, but I think we call these kids as picky eaters. So I usually advise, when you're building a plate for the child, you should have a safe food and a new food. So at least if the child is not having a new food, he will eat safe food.
Yes.
But suppose if you just offered one food and it's a new food and he denies it, and then you say, okay, I'll go in the kitchen and make this for you. So he will think, okay, I'm going to get something else. And then the cycle continues. But it's very important that everybody in the household, especially in a joint family, has to be on the same page for this. Because the mother says something and then somebody else does something, then it really doesn't work out.
Be selective, be right.
Yeah.
And also make sure that there is a gradual change from one food to another, and introducing variety of food is very important in order to make sure that the picky eating stops at one point.
Yeah. I think one more important thing is that picky eating is just a phase.
Yeah.
It's going to pass.
Yes.
So it's not going to be like...
Very true.
Yeah. It's not going to be like it's going to continue for months together or something. It's just a phase. So you really need to be patient with it. And don't give too many choices also. Like, I think you should never ask a child, a picky eater, like, what do you want in breakfast? Like, that's just too much. What if he says, I want French fries? What are you going to do? So rather just give two options, like whether you want to have a stuffed paratha or whether you want to have an oatmeal pancake.
Yes.
And let the child decide between the two options.
Right.
So
And another thing that I have observed so far is if we include the kids during a meal prep, it really helps them to create that dimension of what food is like.
Yeah.
How is it made?
Yeah.
Why is it, if a puri is there, why is it circle in shape?
Yeah.
Why is it bulged?
Yeah.
And if the vegetables are in place, then vegetables peeling and all should be introduced very early on for them to get an exposure with the right kind of food.
So here I think the grocery shopping is also very equally important, because you will be taking the kid. So they will be seeing that what all things are there, what all my mother or my father is taking, how are they preparing it at home. So all those things are also going to be very interesting for the child, and he may maybe eat something which he may normally not eat just because he's been involved in the process. He may eat it.
So this is very basic. It starts from when the kid has started to eat, from the weaning phase. So is that the time when sugar intake or even salt intake should be monitored a lot?
Absolutely. First and foremost, I think you need to minimize the sweet intake.
Yes.
Because kids inherently, they have a little sweeter tooth. So I would say less than 2 years.
They have sweeter tooth from the beginning?
They are a little more, have a predilection, I would say. Like if the child is exposed, for example, the child is exposed repeatedly to sweeter foods compared to repeatedly, vegetables.
Right.
So they are going to choose the sweeter foods.
Yes.
But yes, if you're exposing to vegetables more and comparatively sweet or less, then the child is going to have...
But our Indian system, and especially our Gujarati household, where we all have a sweet tooth, and from our dals to our kadhi also, and to shiras and to our sabjis also, everything is sweet.
So I really think, because studies have shown that increased intake of added sugar can lead to obesity, diabetes, hypertension.
From a very young age.
Tooth decay, you can have hypercholesterolism, you have fatty liver disease later on. So there are so many diseases which are linked with increased sugar intake. So it definitely needs to be minimized. So less than 2 years, it's recommended that no added sugar. And as you just said, it's very difficult to have that in an Indian household. But I think it starts from you. If you're going to do that, then your child is going to do that. So if you are going to cut your sugar, your diet is going to have less sugar, your child's diet is going to have less sugar. And I think that's the first step you should be taking. Secondly, after 2 years, I think the sugar can be started.
So which form of sugar can be given?
I think the natural form. Added sugars also you can start. There is a recommended intake. It's 6 teaspoons in a day.
6 teaspoons a day?
A day, yes.
Okay.
That's the limit for 2 to 18 years.
Okay.
Yeah, that's it. So it's 25 grams.
But I wouldn't know anybody who has followed this.
I'm sure everybody
we don't follow it, right?
Yeah, and in fact, I think even for women, intake limit is 25 grams. That's 6 teaspoons. Not more than that.
So this is building up that habit of eating sweet. If you are exceeding 6 teaspoons a day, meaning it will increase our sweet cravings, and it is also going to result in not eating healthy, because if we are eating sugar, it's empty calories. It's going to bulk up the calories, and once the calories are high, then you don't feel like eating the fibers or any other vitamins which come from vegetables or protein.
Like, for example, in fruits also, it's actually natural form of sugar, but because there is fiber in it, you're going to handle that sugar well. But you're going to have that same sugar in a refined form directly, you're not going to handle it well.
So white sugar is the refined sugar.
Yes.
And which is the reason of the sweet craving. So this is one basic preliminary reason why picky eating starts. Excessive sugar in first 2 years of their lives through eating even outside food, like a junk food. If a kid is given French fries or it's given a chocolate, it's gonna relate to picky eating at an age which is 4, 5 plus.
Yes, and relating it as in the form of a bribe. Okay, you know, do this, you will get a chocolate. Do this, you will get that. Eat this, you will have a dessert.
Yes.
Okay, so they think that this particular food is so rewarding that I'm not getting it at the time, and I'm getting it if I do this work. I'm getting it later.
So they'll think it's a reward.
Yeah, and that food goes on the list higher than the rest of the foods. So that thing should not be done equally. Like all foods are equal. No foods are bad. So at the same time, I would not label as sugar or a chocolate or a cookie as bad. But don't, that you eat this, then you're going to have this. So they're going to be
rewarding is not right.
not
Definitely.
right. Absolutely.
Yeah, and these younger kids, and especially this generation, which is growing really fast, they pick up the words and they pick up the food choices very early.
Yes.
How to resolve picky eating, or how to make informed choice for your kid, or if your kid is not at all eating, how to stepwise show the mother or the caregiver to make sure that the complete and the balanced diet is given to them.
So I think first and foremost, if you're having screen time during meals, like the child is habituated to eating in front of a mobile, a TV, an iPad, and trust me, but every second or a third patient that I see is having at least 2 of the major meals, if not 3,
with the screen.
With the screen. So it affects their hunger cues, it affects their satiety cues. They are actually so many times, they don't know whether they are full or not.
Yeah, and also what they are eating, they'll definitely not know.
Yeah.
Either they are being made eat, somebody's helping the kid to eat, or they are eating on their own, but they'll not know that what that food is.
So I think first thing, we really need to minimize this screen time usage during meals. Second, even reducing the milk intake, because a lot of time what happens is that the child is on like 700, 600 ml of milk a day. Then the solid intake is going to be compromised.
700, 600 a day, 3 glasses of milk.
Yeah.
Every day.
Yeah, a lot of kids actually even drink up to 1 liter, and they are like 2 years old, and the mother will usually complain, okay, my baby is not eating food, but your baby will not be eating food because your baby is having predominantly milk.
And the nutrition in milk is not enough, and even the flavor which will be put in the milk, either it's a plain milk or a formula milk, will be little sweet in taste.
Yes, and it's not a wholesome food as it was propagated before. So that also needs to be in check. And
there is a WHO recommendation, below the age of 18 months, a kid cannot have screen time at all. And once you start suffering, then coming back to it again will take a lot of time. So it's ongoing process.
What I have seen with my personal experience is like neutral families, where you have just the father and the mother, and both of them are working, and they are like, after a long day they've come home and they are tired and they don't have that support, so they resort to using screen time during meals, because they also want their peace and they also want the kid to eat faster and just complete their plate,
not jump around with the kid and and a plate.
And the second thing, I think a lot of mothers feel that in front of the screen they are eating everything which is there. So they feel let him have 3 rotis. No, at least he's having 3 rotis.
But consciously he's not having that roti. He's just filling his tummy and he will not eat what he should be eating. So, as we know that the screen time has increased so much, every household with a kid has an issue of screen timing. So, what can we do to decrease it gradually, and how can parents feel better?
So first, I think every parent and every member of your household has to be on the same page. If you are not offering screen time, then your grandparents also, or maybe your uncle, or maybe your nanny, or whosoever, everybody has to follow the same set of rules. You cannot follow something else and then somebody else following something else, then it's not going to work for your kid. So you need to set boundaries and everybody has to respect that boundaries. That's number 1. Second, I would say if your child is addicted to screen time, say for example, all 3 meals with screen. So work on it gradually. You're not going to
Yes.
move from 3 meals to 0 meals in just 2 days. And that's very irrational to expect from yourself also and from your kid also.
Yeah.
So go for one screen-free meal.
Okay.
Yeah, work it out for like a week, 2 weeks, and then.
So usually takes like a week's time to
Yeah.
get used to not having the screen during the
Yes,
meal. Okay.
yes. Other thing I would ask the parents is that you have to be mentally prepared that when you're going to stop the screen time during meals, it's going to affect their appetite. Number one, because they are going to be in a tantrum phase. That why you're not giving me the screen time when they are used to having it. So that is how their system is conditioned, and you're stopping it. So you're going to face tantrums. Now, in that scenario, if you again give in to that, and then then it's going to be a vicious cycle, and it's going to be difficult to come out
Overcome
of
that,
that cycle.
yeah.
So you need to be calm during that tantrum phase.
And should anything else be given in case of not giving the phone? Can you give them something else, or try to just be free during the meals?
Yeah. So, in case if your child is severely addicted, I would say obviously best is distraction free and like responsive eating and all. But to be honest, because in the generation that we are living in, it's sometimes really difficult to follow that. But yes, what you can do is maybe tell a story, or maybe talk about your food, talk about
Replace
your
it
day.
with a book also, which talks about food.
Yes.
Right.
Or maybe you can just play with the food, like make some shapes with the roti, or make
it interesting.
The
The only reason they are watching that screen is because it is something colorful and it has a sound to it.
Yeah.
If we do the same without phone, it's possible.
It's possible, yes.
So gradually in a 15 days or 20 days time, your child can be screen free if you follow these steps.
Definitely.
Yes. So how to achieve optimal growth curve in young kids?
It is said that the first 1,000 days, which is the 9 months of your pregnancy and the 2 years after birth, those are the most important days for the brain growth of your child, and not only brain growth, the entire growth of your child. So nutrition during these 1,000 days is very important, and besides the pregnancy diet, I think the next most crucial step is breastfeeding, because breastfeeding is not just food, it's much more than that. So exclusively breastfeeding your child till 6 months of age, and after that up to 2 years of age is what's recommended. And this will help your child in building immunity, developing a good IQ. The allergic diseases are also less common, and I would say breastfed babies are way stronger than formula fed babies. Obviously, when there is an indication and your milk supply and everything is affected, you would go for formula, but breast milk is the best nutrition that your child can get.
After that age of 1, what are the meal requirements for the child with supplementing breastfeeding or formula feeding, and how to achieve that growth as well after first year?
So I think it starts at 6 months when you start introducing solid foods. So those times it's very important that you give iron-rich food to your baby, because it is said that the iron, whatever was stored in the baby, it gets depleted. So this 6 months to 1 year is a very crucial time to provide iron-rich diet to your child.
So iron could be in the form of a date or millets, ragi, dry fruits. Yes.
Green leafy vegetables. Right. Pulses, legumes. So or even jaggery.
Yes.
Right.
So jaggery comparatively has minimal iron. Comparatively, but it can be recommended.
So like for those people where they are not really able to afford a very higher nutritious diet, but at least you have something on your plate. So like a little bit of jaggery, not too much, but a little bit of jaggery would also help. Beyond that, no sugar, no salt, well, minimize as much. I know is a very strong word, but minimize the use of sugar, minimize the use of salt till 1 year of age. And your target should be that the child is shifted to your family pot feeding,
Yes.
as in whatever you are cooking.
Whatever we cook, the kid should eat. Probably less spicy, less oilier, but the kid can eat the same meal.
Yes, yes. And they should be exposed to all the spices as well. Like everything that we are using, they should be
Exposed to it from a younger age.
So that after 1 year, your child is actually eating what you are eating.
And that makes the transition pretty smooth.
Smooth, yes.
Beside that, the balanced plate from fruit to protein and to carbs as well and fat. What should be the ideal balance in a meal plate?
So actually the ideal recommendation is that in a 9-inch plate, half of the plate should be with fruits and vegetables.
Yes.
Yes, and that should be obviously added with healthy fats like olive oil, for example. And
Olive oil, ghee also.
Ghee also, yes.
Yes.
The other half you should be divided into carbs and protein.
Okay.
And supplemented with a drink like water, for example. No soda, no beverages like sweet beverages.
No.
Fruit juice intake should also be limited.
Rather, we can give them the whole food to eat.
Yes,
for high
direct
fiber.
fruits are always preferred over fruit juice.
So, how would you suggest a mother to shop consciously?
Yeah. So I think first and foremost, you should be rotating between different kinds of grains or different kinds of flours. So making a list, a conscious list of all healthy foods. You should have it in mind that I want my child to have ragi, I want my child to have jowar, or I want my child to have oatmeal. If it's in your mind, then only you want to go and pick that product up. And not just ragi all the time, but a rotation between all different grains.
Yeah,
like
and oils as well.
Yes.
From rice bran oil to olive oil to coconut oil as well.
Yeah. So keep on rotating between everything. That's number one. Secondly, nowadays we have a lot of easy breakfast cereal options also available. So I think it's very important that we know, we should know how to read the labels, because it's very easy for a brand to write that no artificial preservatives added or no added sugars, or it's natural. But how is it actually natural? Is it actually no added sugar? So you really need to go behind and read the label.
So clean label would be basically making sure that there is no artificial substance in it. The product can be organic or not is one thing, but artificial substance like a color or a synthetic sweetener should definitely be not there for the kids.
Yes.
Right. And that concludes another episode of Food Pharmacy with Dr. Ashka. Thank you so much for being here. Today we learned so much about food that we have to give to our kids, and which foods that we can give, which foods that we cannot give. It was very insightful, and I'm sure our viewers are gonna love it. Looking forward to doing another episode with you at Food Pharmacy for breastfeeding and lactation, because you're an expert in lactation. We would really like to know what is right, what is wrong, what are the myths, how can we improve it?
It was a very good experience being at Food Pharmacy here, and I really hope that everything that we have discussed about kids' nutrition today has helped our viewers, and it has helped solve their day-to-day queries as well.
Until the next time, remember to nourish your little ones with lots of nutrition, food and love.